Welcome. We're here at the Transplant Center at the Christ Hospital. I will guide you through the live organ donor program. Each section of this program is broken down into chapters, so you may watch the entire program or at a later date review individual chapters to refresh your knowledge as you move through the entire transplant process. The information presented will provide you with valuable insight regarding kidney transplants and the requirements to be a successful candidate.
Welcome. My name is Dr. Michael Carty, and I am the Medical Director of the Kidney Transplant Center here at the Christ Hospital in Cincinnati, Ohio. Hospitals, transplant centers, and physicians are not all alike. They vary in quality due to differences in their training and experience. Differences in quality matter more when you need sophisticated medical care for a complex medical condition. You and your physician have made a wise decision in selecting the Christ Hospital Transplant Center. We performed our first kidney transplant in 1972 and have now completed more than 1,400 kidney transplants. We currently average 50 to 60 transplants per year. The Christ Hospital has been rated among the best hospitals in the United States year in and year out. To further evaluate our transplant program and how it compares to others, I strongly suggest you visit the website ustransplant.org for current information. Reviewing this program will greatly assist you in working with our transplant team to ensure a most successful outcome. Thank you very much.
According to the latest statistics from the National Kidney Foundation, there are over 70,000 people in the United States waiting for a kidney transplant. Because of the lack of available donors in this country, 3,916 kidney patients died in 2006 while waiting for the life-saving organ transplants.
I'm Greg Werman. I live in Lakeside Park, Kentucky. My wife Diane and I have 4 daughters and 7 grandchildren. Well, I'd known EJ for quite a long time and had seen his condition deteriorate somewhat over the years, and he had told us about the dialysis and the rather difficult experience that is. And I learned a lot from listening to EJ, and I just decided I was going to do this, and I wanted to do it. The first thing I did was I met with EJ's nephrologist, kidney doctor, and for a physical, and it was so brief, and it wasn't what I was expecting. I thought I was going to go through an entire exam, and really it was a history. They took my weight, pulse, blood pressure, and we chit-chatted for about 5 or 10 minutes, and he said, okay, thanks very much, and we'll be back with you. And then a couple days later, I got a call from the transplant manager here, Ann Demi at Christ, and that started the ball rolling.
In the last 3 or 4 years, I have put on a lot of weight, about 30 or 40 pounds, and I'm sure a lot of it's due to menopause or whatever, but I exercise a lot, and I eat well, and so my husband and I went to doctors to try to figure out why I'd been gaining this weight. And they couldn't come up with anything, but kept telling me how very healthy I was. So then when I found out Brian needed a kidney, I thought, well, I know I'm healthy. I've been doing these tests for the last 2 years, so why not see, it just seemed, if I was that healthy, if I could help someone else, it just seemed like the right thing to do.
The advantage for the donor comes from knowing that he or she is helping someone who needs a kidney transplant to greatly improve their quality of life, even to save their life. Virtually all religious denominations approve of organ and tissue donation as representing the highest humanitarian ideals and the ultimate charitable act. The success rate of a live donation is higher than for a non-living donor transplantation. According to the U.S. Organ Procurement and Transplantation Network, OPTN, and the Scientific Registry of Transplant Recipients, SRTR, 5-year success rates for people who've received a kidney through living donation are approximately 10% higher than those who receive their kidney from a deceased donor. Reasons for this may include a better genetic match, which lessens the risk of rejection. The kidney from a living donor usually functions immediately because it does not have to be transported long distances. It can be transplanted immediately from the donor to the recipient. The transplant surgery can be scheduled at a time that is convenient for both the donor and the recipient.
I'm Jim Deneen. I live in Westchester, Ohio, and have been a resident of that area for most of my life. And Joyce and I have been married for 43 years this year, so we've had an interesting life together. I had my transplant in November of 2003 when Joyce graciously gave me part of her body, which has worked out quite well. I've had an extremely successful transplant.
For me, it was kind of a no-brainer. I mean, it's just something that I knew was right and wanted to do. I just, like Jim said, he had 3 donor matches. He was very blessed that way. I went through all the testing. I really just, once I knew it was something that I personally wanted to do, I just started and going through all the testing and really didn't look back.
I would say, first off, you have to make sure that you're healthy. But after that, it's almost selfish of you not to try to help fellow people. When I first made the suggestion about it, I hadn't even told my husband. I walked back and said, "Oh, by the way, I just offered to donate my kidney to Brian." He goes, "Oh, okay." So you have to make sure everybody's on board with it, but it's also, it gives you such an opportunity to do something good for someone. I mean, it makes you feel so good inside. It's something you can't really put into words. And I would think anybody who does it is very, very lucky to have that opportunity.
My name is Madeline Johnson, and I gave my dad a kidney. It's been almost 5 years this April, and when the process started, we were all tested. Out of 4 kids, I was the only match. I had already made the decision that if I was a match, that I would donate the kidney, and I just thought it was the right thing to do, because my dad's been a great dad, and it just freed up his life again to be able to travel and not be tied down to dialysis and that whole process.
The Christ Hospital has the following general requirements for donors. You must be in good health. You should have a body mass index of 31 or below. Remember that weight is individualized. No diabetes, no high blood pressure, no kidney problems, no cancer history. You must have a compatible blood type with the recipient, non-smoker, no chronic back conditions or injuries. As a donor, your evaluation will be coordinated by the Transplant Center. Time will be allotted for asking questions and addressing any concerns you may have. If you have reservations about being a donor, the transplant team can provide confidential advice. Time spent with a transplant coordinator, physician, and donor advocate is an opportunity for you to express any concerns in a confidential environment. When the tests are completed, the results are presented to the transplant team to determine if you are a suitable candidate for donation. The length of the testing process depends on your availability for testing, the results of the completed tests, and the individual policies and procedures of the transplant center involved.
I went through a series of tests, which begins with the blood test, and then you go through the test at the medical arts building, which were quite extensive, but they're also very helpful because you get a complete physical when you do this. I mean, you know pretty much about yourself when you're finished, and I did that, and everything went very well. It all started in November and December of '05, and then into the first part of '06. and I was amazed at how thorough they are in testing the donor. I mean, they knew more about me than I ever knew about myself, but that was good, I guess.
As a donor, there are a series of tests you will need to do before the transplant can be scheduled. First, we will draw blood for a test to see how compatible, how well you match your relative or friend. This blood sample requires having a good meal prior to having the blood drawn and needs to be scheduled on a Monday, Tuesday, or Wednesday so the Hawksworth typing lab can set up and prepare the blood samples. This first test can take about 2 weeks to complete. We will call you with the results. Here is the blood type compatibility chart. Next, we will need to make an appointment with the kidney specialist for an exam to determine your physical capability to be a donor. Third, set up a date to bring in a 24-hour urine collection, a blood test, and a kidney ultrasound. You will have to have blood testing, a chest X-ray, EKG, and possibly other tests after your lab results are evaluated. Fourth, set up a date to have a CT scan. This is a special study that will give us pictures of your kidneys and the number of blood vessels coming from your kidneys. And finally, set up a date for a social work evaluation.
And then the last test we had was with a social worker, which I was kind of surprised about, but they want to make sure that you're very positive about what you want to do and what you're and the decision you've made. And one of the final things that the social worker said to me is, "Now you realize you can back out at any time you want, and nobody will ask any questions." I said, "Okay, thank you very much." Well, the morning of the transplant, Dr. Buell, who took my kidney, came in the room, and I'm prepped and ready to go. My wife was standing there, and he introduced himself. We talked for a little while, and he said, "Now you know you can back out if you want to." I said, "I don't want any more. I don't want to hear it again. Let's go. I'm ready." So they keep you on the hopping edge and saying you can always back out if you want to.
Next, plan a meeting with one of our surgeons and set up a date for the surgery that is compatible with our schedule, you, and the recipient. This will be done after presenting your test results and CT scan, so all the physicians can review your studies as a team. All female donors are required to have a Pap and a mammogram evaluation within the last 12 months. A psychological evaluation will take place to make sure both the donor and the recipient are mentally and emotionally ready. 7 to 8 days before your surgery, you and the recipient will come in for pre-admission testing, including both blood and urine tests, as well as a pre-op physical and a final cross-match in preparation for the transplant. Any bills you receive inadvertently, send them along to our financial counselor so we can get them paid in a timely fashion. More tests may be required during the workup step if preliminary tests are abnormal. Once the transplant team has the results of all the necessary tests, and if these results show that everything looks good for the transplant, surgery can be scheduled. Should I stop smoking before my surgery? You must stop smoking to be a donor, even if you're a light smoker. Smokers have an increased risk of cardiovascular and pulmonary complications with any surgery. Should I stop drinking alcohol? If you're going to be a donor, it is best that you stop drinking. If you have a history of heavy alcohol use, it is very important that you tell our doctors. While alcohol use may not preclude you from being a donor, it is important to stop drinking prior to being a kidney donor. You should not return to drinking alcohol after surgery until advised it is safe to do so by the transplant team. Should I stop taking my medications before the evaluation or the surgery? You should not stop any prescription medication unless advised to do so by a physician. You should also avoid aspirin or non-steroidal medications such as Advil or Motrin for 7 days before surgery. These medications can affect the ability of the blood to clot and put you at higher risk of bleeding complications. Instead, you may take Tylenol if needed. Women who take birth control pills will be advised to stop taking them 30 days before surgery because of the increased risk of blood clots after surgery. Do I need any special diet before surgery? You can eat and drink normally until midnight the day before the surgery. You will need to take a laxative the day before surgery. If you regularly take any medications, we will instruct you about these when you come in for the final appointment before surgery. What should I bring with me to the hospital? Bring only minimal belongings and no valuables. Because we have your insurance information, there is no need to bring any documentation with you unless it is requested. Leave all jewelry and other valuables at home or give them to your family for safekeeping. You may want to bring a basic toiletry bag for your use in the hospital. You will arrive on your surgery date and come to the same-day surgery department. Before you go into the operating room, you'll be asked to wear a hospital gown, empty your bladder, remove your dentures or partial plate if applicable, remove eyeglasses or contacts, remove jewelry, nail polish, hair ornamentation, and body-piercing hardware. Please send all valuables home with your family, including cell phones. Your pre-op nurse will prepare you by drawing 2 labs, starting 2 IVs, 1 in each arm. You will meet with the anesthesiologist who will be putting you to sleep. After you're asleep, they will place a central venous catheter into the vein in your neck. This will be used for lab draws and medications while you're here. The removal of your kidney employs a newer and less invasive technique using the laparoscope, which was first used at our center in 1999. This involves 4 small 1/2-inch incisions on the left or right side of the abdomen. These small cuts are used to introduce special instruments, which can be used to dissect out your kidney. In the final step, a 3.5-inch cut is made on the lower abdomen for removal of your kidney. This technique takes about 4 hours and does not require the cutting of any muscle.
Hello, my name is Amit Tivar. I'm one of the kidney transplant surgeons here at the Christ Hospital. Now, you may have a few questions concerning your upcoming kidney transplant procedure. And to help you understand this, we will now illustrate some of the steps of the surgery. With the live kidney donation, surgeries are overlapped. The donor is called to the operating room first, followed by the recipient an hour to an hour and a half later. A general anesthetic is administered in the operating room. Generally, the donor and the recipient are in neighboring operating rooms. The donor operation takes approximately 2 to 3 hours to complete. The donor's single remaining kidney will take over the work previously done by both kidneys. The kidney is carefully removed and immediately transplanted into the recipient. The recipient operation lasts approximately 3 hours. In addition, the time necessary for anesthesia before and after the surgery may be 30 to 60 minutes. The surgery staff will call your waiting relatives as soon as the surgery is finished to report on your progress.
The usual hospital stay is 1 to 2 days, including the day of surgery, with the potential to return to work in 3 to 4 weeks. The amount of pain from the incisions and bloating that occurs after the surgery is typically less in patients who undergo the laparoscopic procedure. Unfortunately, you may have significant pain after this surgery. We will give you pain medication, but despite the medication, you will still be uncomfortable for at least the first week. You will begin to have less pain as each day goes by, but most of our donors have told us that they still had a significant amount of discomfort for 1 to 2 weeks after the surgery. Most pain medications make you drowsy, can affect your breathing, may cause nausea, and can also cause constipation. We will be trying to get the right balance of pain medication to make you comfortable but not drowsy, so that you can do your deep breathing exercises, cough, and walk. A prescription for pain medication will be provided to you before you leave the hospital for pain control at home.
There's some pain involved, and you get lots of medication to handle it. I'd never been sick before, so that was a little bit of a shock, but it was okay. I'm an LPN. I was out of work for 6 weeks. due to weight restrictions and all that. But I was up and about and doing everything pretty much that I could do at home before, besides lifting and other strenuous activities, but it wasn't really that bad.
After the laparoscopic nephrectomy, it is not anticipated that you will have any prolonged problems related to the surgery. As soon as your intestines start to work again after the surgery, you will be able to eat and drink again. If you do not have nausea or vomiting with sips of water, you will be able to progress to clear fluids and then to a regular diet within the next day. As soon as you wake up from the anesthesia, you will begin exercising. You will need to take deep breaths and cough to make sure you're getting air into all the cells of your lungs. This will help prevent pneumonia. You will also begin to exercise the muscles of your legs by flexing and relaxing them periodically. You will be helped out of bed the day after your surgery and begin walking. We cannot stress enough how important walking is to your recovery. Each day, you should be pushing yourself a little bit more. By walking as soon after your surgery as possible, you will help prevent complications such as blood clots, pneumonia, and muscle wasting. You are encouraged to continue a program of daily walking when you go home. Remember, the goal is to be back to normal health within 6 to 8 weeks. If the surgeon feels your condition is stable, you may be discharged home after 1 day in post-op recovery. If not, then you will stay until the next day.
Well, the first thing when I came to, the first thing I asked was, how was Brian? What happened? And they said, you gave him the Hummer kidneys, girl. He said, it's functioning right away. So that made me feel really good.
I was home in a day and a half, which I thought was amazing. A day and a half I was home, and I felt really good, tired, fatigued, and the surgeon said, you're going to be fatigued for a little while.
After you return home, you should gradually return to your normal activities. You will be restricted from lifting objects heavier than 10 pounds for the first month. This allows your incisions time to fully heal. It's also important to avoid straining for 1 month. Walking is advised, and you are encouraged to gradually increase the distance each week. If you are feeling well and are not having any complications, you may begin to return to your normal exercise activities. Begin slowly and build up your strength and stamina. We expect that most patients will return to a normal life within 6 to 8 weeks after surgery, provided you do not experience any serious complications. Depending on your occupation, you'll be able to return to work or school within 1 to 2 months from your surgery without restrictions. Disability papers will be completed for you during your period of unemployment. The minimum amount of time you should allow yourself to recover is 4 to 6 weeks. Because people recover differently, with varying degrees of fatigue and pain, you may need as long as 8 to 12 weeks. We prefer that you be in a position, both financially and from a job security perspective, to be able to take 8 weeks off from work should you need it. We advise you not to drive for at least the first 2 to 3 weeks after the surgery. You must be physically and mentally strong with normal reflexes and not experiencing any abdominal pain or discomfort before you decide to drive. You should not be taking any medication that can affect your mental alertness. Pain medications containing narcotics like Vicodin, Percocet, or Tylenol with codeine can affect your mental alertness, and you should not drive if you're taking these types of pain medications. You will probably want to refrain from sexual intercourse for a couple of weeks until you have less discomfort and are feeling stronger. This decision is based on how you are feeling. For female donors, we recommend that you do not become pregnant for at least 6 months after surgery. This procedure is major surgery, and we need to monitor you very closely at first to ensure that your recovery is progressing normally. You must come back for a checkup about a week after you leave the hospital. You will probably need another checkup 4 to 6 weeks after your surgery. You will need an annual follow-up with your local physician for the rest of your life. You will need to remain close to the Christ Hospital for at least 2 to 3 weeks after your surgery. You will also need to be able to return to the Christ Hospital if you experience any problems during your recovery. We recommend that you have a relative or friend stay with you, especially immediately after you leave the hospital. You should not plan any vacations or trips outside the United States for at least 4 weeks, and preferably 8 to 12 weeks after your surgery. If you wish to return to your home in the U.S. and you have a good local physician, you may be able to do so within 2 weeks after the surgery, depending on how you feel and how you're recovering. Remember, if we have any concerns about possible complications, we will want you to return to the Christ Hospital for evaluation and treatment. It should be no problem for you to take trips or vacations after 8 to 12 weeks.
I was off work for about 10 days, a week to 10 days. And then when I went back to work, I just went back gradually. I followed his advice that I'd walk every day, and I did that for a little while. Oh, not for a little while, I did it for quite a while. I would start off walking a block or two, and then the next day I'd walk a block, another block. Each day I'd increase it. And it all went very well. Well, it was about 4 to 6 weeks before you really get back to normal. And I would say within that period of time, I did resume normal activities. But as far as going back to the office, when I went back to the office, it was about I think it was about a week. It might have been a little bit longer, but not much. I felt fine.
If you're healthy, if you can get through the testing, you have the desire, and I would do it again, but I don't have another kidney to do it with. So, I mean, that's really what I would tell people.
I've told the kids and my kids, and if I speak to bar association members, as EJ and I sometimes do, we always talk about, get a donor organ card and put it on your driver's license, and encourage others to do that, because there's such a need for organs, and people who you don't realize what a tremendous difference it makes in their lives until you're there. It's an incredible opportunity that not many people get to do that, to help someone else in life, and you only need one, and mine's doing fine, and so. Oh, that definitely was a positive experience, and it was for my family too. I mean, I think anybody in my family would do the same thing if the need arose.